Hi, my name is Dr. Deepen Patel, and today I'm going to provide some information about the different coronavirus vaccines available, their effectiveness, and levels of protection provided by each vaccine, the possible side effects, vaccine myths and truths, COVID variants, and long COVID. The coronavirus vaccine is safe and effective. It gives you the best protection against coronavirus. The NHS is currently offering the COVID-19 vaccine to people most at risk from coronavirus. The vaccine is being given in some hospitals, pharmacies, and local vaccination centres run by GPs. The vaccines approved for use in the UK have met strict standards of safety, quality, and effectiveness. All the vaccines approved go through clinical trials and safety checks similar to the flu vaccine. Vaccines are only available on the NHS once they've been thoroughly tested to make sure they're safe and effective. Currently, there are 4 COVID-19 vaccines. 3 of these have been approved for use in the UK. These are the Pfizer-BioNTech, Oxford AstraZeneca, and Moderna COVID-19. The Pfizer and Moderna vaccines are very similar. They use a genetic code that teaches the immune system how to trigger an immune response. The Oxford AstraZeneca vaccine uses a modified virus to tell your body how to trigger an immune response. The COVID vaccine is an injection that is given in your upper arm. It's given as 2 doses, and the second dose is normally 3 to 12 weeks later. Some people cannot have the vaccine, and this is if you've had a previous allergic reaction to the first dose of the vaccine or any component of the vaccine. Some people may experience side effects after having the vaccine. These can include injection site pain, redness, and swelling, but other side effects also include headache, tiredness, muscle ache, fever, chills, joint ache, and nausea. Most of these side effects only last a few days, but can last up to a week. If you find you're having a fever or muscle pain, you can take paracetamol if you need to. If the symptoms get worse, you can always call 111 if needed. So, how effective is the COVID-19 vaccine? The first dose of the COVID-19 vaccine should give you good protection from the coronavirus. The second dose of the vaccine will give you a longer lasting effectiveness. There is still a chance that you might still get or spread coronavirus even if you have the vaccine. This means it's very important to continue following social distancing rules. If you can, please wear a mask or face shield that covers your mouth and your nose in places where it's hard to stay away from other people. You should also wash your hands with soap and water for 20 seconds and use hand sanitizer where this is not possible. COVID-19 vaccine trials have only just begun in children, and therefore very limited data is available in this group. Children and young people have very low risk of getting COVID-19 compared to adults. For this reason, vaccines are not routinely recommended for children under the age of 16. There's no evidence that a COVID-19 vaccine is unsafe if you're pregnant, but more evidence is needed before you can be routinely offered it. The current guidance recommends that you may be able to have the vaccine if you are pregnant or at high risk of getting coronavirus because of where you work, or have a health condition that means you're at high risk of getting serious complications of the coronavirus. If you are worried, speak to a healthcare professional. You do not need to avoid pregnancy after having the vaccination. The vaccine cannot give you or your baby COVID-19 or affect your fertility. Tell healthcare staff before you're vaccinated if you've ever had a serious allergic reaction. Serious allergic reactions are very rare. If you do have a reaction to the vaccine, it usually happens within minutes. Staff given the vaccine are fully trained to deal with allergic reactions and treat them immediately. Currently, there are different types of tests available. This include the lateral flow testing, which is a form of rapid testing. There is also PCR testing, which is nucleic acid testing, and antibody testing. I will now go on to show and demonstrate how the lateral flow test is done. First of all, we start by getting a sampling swab. We insert it into your nose, like so, in both nostrils as far as possible. You hold on to this and then you get the extraction tube. In the extraction tube, you need to apply extraction solution. 6 drops of this goes into the extraction tube. Using the swab, you then place this into the extraction tube like so, and press and make sure that you get rid of all the cells into the tube. The tube also has a lid which you close like so. You then get the cartridge and put 2 drops of the extraction solution onto the cartridge like this. It will then appear with 1 or 2 lines. One line on the C, which indicates it's a control, that's negative. If you get 2 lines, which is the C and the T, then that's positive. You have to wait 30 minutes for a result. I will now move on to the next test, which is a nucleic acid detection. This uses the PCR method. First of all, you need to obtain a sample using a swab like this from your nose and from your mouth. You then send it to the lab, and the lab will then extract the RNA and convert it into DNA. They use a special technique and then they deliver the result to you. This is either positive or negative. Viruses constantly change through mutation, and new variants of viruses are expected to occur over time. Sometimes these new variants emerge and disappear. Sometimes they emerge and stay. Currently, there are 3 variants of the virus. These are the UK variant, the South Africa variant, and the Brazil variant. Myths and truths. The first myth is you don't need to have the vaccine if you already had COVID. The truth is, we do not know how long protection remains after COVID, and therefore having a vaccination is advised. Myth number 2, the vaccine will modify my DNA. The truth is, there's no way the RNA can change the DNA of anyone. The RNA vaccine teaches our cells to make a protein that triggers a protective immune response. The RNA is broken down as soon as it enters the body. RNA doesn't enter a nucleus cell where DNA is stored. Myth number 3, COVID vaccines can make you infertile. The truth is, there's no evidence to suggest the COVID vaccine causes infertility. Myth number 4, I'm young and low risk, so the COVID vaccine isn't for me. The truth is, adults aged between 16 and 64 account for 40% of daily COVID admissions to hospital. Although the risk is higher with age, COVID can affect anyone at any age. Myth number 5, the COVID vaccine can give you COVID. The truth is, no. You cannot get COVID from the COVID vaccine. The vaccine teaches your immune system to recognize and fight the virus. Myth number 6, vaccines contain alcohol. The truth is, the Oxford AstraZeneca contains ethanol, which is alcohol, at an amount that is less than what is found in natural foods and bread. Myth number 7, vaccines contain animal products. The truth is, the approved COVID-19 vaccines do not contain any products related to animals or eggs. Myth number 8. Vaccines should be 100% safe before being released to the public. The truth is, vaccines are a safer way to prevent vaccine-preventable diseases, but no medication is 100% safe. Myth number 9. If I decide not to have the vaccine, it does not affect others. The truth is, your decisions don't just impact you, but affect everyone, especially the most vulnerable and sick. Myth number 10. Catching COVID after having the vaccine is proof they don't work. The truth is, the immune system can take a number of days or even weeks to generate an immune response before protection from the virus begins. I'm now going to talk about long COVID. For some people, COVID-19 can cause symptoms that last a few weeks or even months, even after an infection has gone. This is sometimes called post-COVID-19 or long COVID. Although many people feel better in a few days or weeks after the recovery, but it can take 12 weeks. Symptoms can even last longer than this. Statistics in November 2020 showed that 1 in 5 people who tested positive for COVID-19 had symptoms that lasted 5 weeks or longer. 1 in 10 people had symptoms that lasted 12 weeks or longer. Common long COVID symptoms include extreme tiredness or fatigue, shortness of breath, chest pain or tightness, problems with memory and concentration, difficulty sleeping, heart palpitations, dizziness, pins and needles, joint pain, depression, tinnitus, earaches, feeling sick, diarrhea, stomach aches, loss of appetite, and a high temperature with cough, headaches, sore throat, and a change of sense of smell or taste. The chances of having long-term symptoms are not linked to how ill you were at the beginning. There's still a lot to learn about how long COVID can affect you, and therefore the NHS have set up long COVID clinics. If you're still experiencing symptoms, please speak to your GP to be referred to one of his long COVID clinics for further investigation and assessment. Thank you for listening, and stay safe.